relax here. And there we have it. If you are suffering from costochondritis, there is hope. Trust me, there is. Hi everyone, Dr. David Culla here with Synergy Wellness in New York City. I realize I have a mask on, but believe it or not, COVID is still running around New York City. And in 2024, we just had 2 exposures in the last 2-3 weeks. So I was exposed this week, so that's why I'm wearing a mask. I'm sorry, I hope you guys can hear me clearly. I'm gonna speak up loudly, but we wanna keep our patients safe. And this gentleman traveled all the way from California to treat here in New York City for his costochondritis. At this point, how are you doing? We're about, what, a week and a half in? Or two weeks in?
Yes.
So he stayed here for about 2 weeks, you know, for treatment. And why don't you tell folks how you're doing?
Amazingly improved. Suffered for about 10 years, variety of doctors, treatment centers, nothing worked. And I could take deep breaths and it's lasting now. The treatment is starting to, I would say I'm probably about 60 to 70% of where I need to be. It's miraculous.
Yeah, obviously we'd love to treat him more. He has to go back to California, but I think he'll be back here in New York to finish up the treatment, the care. He had a pretty severe case. I mean, you could feel all the muscular adhesions in the chest area. So we're working on breaking those up now, and we just kind of went deeper with the laser this week. So that's why he's feeling it. The relief lasts a lot longer, and that will only get better the next few weeks. You know, if we could treat him just a little bit longer. Luckily, he has family here in New York, so he has somebody to stay with. But we do get a lot of people traveling from all over the world and all over the country to treat for costochondritis because they're not getting the results. So I'm going to show you what we're doing right here. We've got 2 lasers on him right now. We're also going to adjust him. But the lasers really help to calm that inflammation down, especially in severe cases of costochondritis. It also relaxes the muscle spasms, and it also will break up scar tissue or muscle adhesion, so it's threefold effect. But the biggest issue is reducing that inflammation so we can reduce the pain. And you hear it beep there. That means it's done dosing that area. So this laser right here, this blue one in my hand, I can check areas of inflammation and soft tissue damage. And it tells me not only where those areas are, but how long to treat them for. So we're using that laser there, and then we've got, of course, this other one up here. And we're gonna go ahead and move this one over to this side. And this just helps speed the treatment up, otherwise he might be here for an hour. And this way we can speed the treatments up, sandwiching him, so to speak, with 2 or sometimes even 3 lasers. We also offer laser rentals, but he chose not to do that. In fact, if you had done that, yeah, that's right. And maybe when you come back, maybe you'd be willing to do that, and that way you can treat twice a day. Whereas when you were here in New York, you were seeing me maybe 3 times a week. So he was not seeing me every day for the past 2 weeks. He's only been seeing me 3 to 4 times a week for the past 2 weeks. So already, you know, after 6 to 8 visits, he's had, I think, would you say 65% improvement?
I mean, I could speak and tell you, that, quite honestly, I'm just amazed. I came in as a skeptic. I've tried a variety of treatment programs.
What have you tried so far?
Basic adjustments, myofascial release, of course, the standard protocol of anti-inflammatory medications, did the entire chest workup, cardiac. Anxiety is a big issue with this syndrome.
Yeah, and your old chiropractor was who?
There's been several. One of them is Franco Colombo, who since has passed away.
Yeah, so for those of you that don't know who Franco Colombo is, he was Arnold Schwarzenegger's best friend and a chiropractor, and also a bodybuilder. So for those of you who didn't hear, he was Arnold Schwarzenegger's best friend, a chiropractor, and a bodybuilder. So that was his old chiropractor, but he passed away. But he turned you on to what?
He turned me on to the fact that costochondritis truly is caused from the problems in the back, Whereas
spine.
almost every location, hospitals, you name it, I've always worked on the front.
On the heart, usually,
On the
yeah.
heart or just the chest, and it never solved
Yeah.
anything, very temporary.
Yep, absolutely. The spine has everything to do with costochondritis. So, seeing a chiropractor is the best thing you can do. If he has cold laser therapy, great. But if you have a mild case of costochondritis, often chiropractic alone can fix the issue. But if you have a severe case, you will need something like this, like cold laser therapy in adjunct with chiropractic manipulation or adjustments, okay?
These 2 to 3 weeks that I've been here are literally the first period of time in almost a decade that I didn't have a period where I couldn't breathe properly, where I was out of breath or getting anxiety. It's amazing, and I'm sold on the laser therapy.
Wow. Yeah. I mean, that's really great to hear. He was also not diagnosed with a hiatal hernia, so we were able to figure that out with him, and he is going to be taking home a patent pending device that I created called the Reflux Shield, and that's going to help him also with the breathing, with the diaphragm being able to lift. And also the panic attacks, right? You haven't had panic attacks in a couple weeks. Those were really severe. Having severe panic attacks, those are gone. A lot of that has to do with the vagus nerve and the hiatal hernia, but also the costochondritis can create that, heart palpitations and panic attacks. So symptoms that sometimes gastroenterologists or doctors, primary care physicians just don't associate with costochondritis or hiatal hernia. So now I'm scanning the ribs here, the floating ribs. And there we go. And we're going to adjust them here in a minute, and I'll show you what that looks like. Hold that right there for me for a second. Keep your eyes closed. You guys can keep your eyes open. So as many of you know that have costochondritis, can be very complicated and frustrating, probably is the better word for it. Frustrating because you can't get the right help or care. And I get it. I really do. I see the frustration in all my patients with costochondritis coming in. Same thing with hiatal hernia. So why don't you tell them kind of the typical protocol that they put you through, and they probably, everybody else watching this can probably relate to that.
Sure. I mean, I belong to the forums on Facebook, on Reddit, and it's a similar pattern. About 35% of all ER admittances for chest pain, if it winds up being costochondritis, the standard protocol is anti-inflammatories, which, unless you have a mild case, do not work. One doctor recommended and guaranteed a cure of 1,000 milligrams a day of naproxen, which just screwed up my stomach. But like I said, I've been all over the country looking for a treatment. What I've read, a lot of people on Reddit and these other forums, they develop anxiety and panic disorder, not so much because of a psychological component, because you tend to breathe very high and very shallow, which develops physical anxiety, which is where I've developed. So their protocol is gabapentin, which doesn't work. You name it, with antidepressants, this is not a psychological issue. It's actually
And you're
physiological.
on antidepressants, yeah.
I've had to try every one of them, and it's just a mask.
Yeah, and honestly, costochondritis is not going to be helped by an antidepressant. They typically give you that if you're having like panic attacks or something.
But this is physiological.
And the reason for the panic attacks is physiological. It has to do with the vagus nerve, okay? And I've done videos on the vagus nerve, 1 or 2 videos on that alone. But I talk about the vagus nerve all the time, and especially with people suffering from hiatal hernias, so which he is also suffering from. So, obviously that makes the panic attacks much worse and more frequent. But you haven't had one since we started treating you, since day one, right?
No, it wouldn't be so much as panic attacks as opposed to breathing attacks. I think
Okay. How often were you getting them? Every day, or?
Every 2 or 3 days.
So he's been, since day one, he hasn't had one, and he's been here for 2 weeks.
And I think another big factor would be, if I would take a really, really deep breath, you'd feel the cartilage stretching and a deep, deep ache. And I'm feeling that going away less and less and less as we've been doing the treatments, which is amazing.
Good. And we're going to finish up here with a laser. And because he has poor thoracolumbar posture, We're going to adjust him in the thoracolumbar area, which is also where the nerve supply to the diaphragm is. We want to stimulate his diaphragm as well. So we're going to address all that today, and he'll be going back to California after that, and we'll see you again when?
Early to midsummer.
Okay.
I'm
All
sold.
right. Keep up your stretches, okay? And if you can,
recommendation of the lacrosse ball.
Yep, all the stretches. And if you guys haven't seen my videos on costochondritis stretches, I certainly have a couple of videos out on stretches for costochondritis. So I hope you guys check that out. And let's go ahead and get you adjusted here. Cross your arms in front of you like this. And take a deep breath in, tuck your chin, and come on up, half a sit-up. Good, and blow all the way out. Good, one more, deep breath in, and blow out. Good. And slide down just a little bit towards your feet. We're gonna do that one more time, cross those arms. Yep, like that. Deep breath in, tuck the chin, half a sit-up. Good, and blow out. Now, the vagus nerve runs up into the cervical spine as well. So we're going to address that. And he's definitely subluxated here in the cervical spine. Relax here. And there we have it. If you are suffering from costochondritis, there is hope. Trust me, there is. Okay, I hope you guys get the right help, and I hope you guys got something out of this video. Thanks for tuning in. Don't forget to hit that thumbs up button and subscribe. Appreciate you. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like, and don't forget to subscribe. Appreciate you guys.